In case number 3, there is a 47-year-old male who presents with pain in his great right toe. He is unable to bear weight on that foot, says that he had no trauma there. He reports that the pain started last night and then continued to get worse. So based off of these physical findings and his laboratory findings, which showed a high plasma urate level with a low urinary uric acid level, he was diagnosed with gout. Gout is when uric acid builds up in the body as a waste product of purine degradation. The purines adenine and guanosine are further broken down until they reach the end product, which is uric acid. Uric acid will then typically travel to the kidneys, where it is excreted through urine. High levels of uric acid lead to precipitation of uric acid crystals. These crystals can accumulate in the joints, which is typically the great right toe, like this patient, and will cause inflammation, pain, and redness in the joints. Uric acid is not highly soluble, and it's difficult to excrete in the human body because we do not have the enzyme that can break down uric acid. The overproduction of purines is often a result of an abnormality in one of the enzymes involved in purine production. An increased amount of purines will lead to increased purine degradation, which will result in excessive uric acid as a waste. Disorders that increase the production of the activated sugar PRPP will also lead to increased purine synthesis because PRPP is required for the initial step of purine synthesis. An example of purine overproduction is in the disease von Gerk's, or glucose 6-phosphatase deficiency. With a deficiency with the glucose 6-phosphatase enzyme, glucose 6-phosphate becomes trapped in the cells and it is not able to be converted to glucose to then leave the cell. This will lead to increased production of ribose 5-phosphate through the pentose phosphate pathway. Ribose 5-phosphate is a precursor for the active sugar PRPP. Therefore, having an increased substrate PRPP will lead to increased purine synthesis. And this overproduction and then eventual breakdown of purines causes high amounts of uric acid to be made. Overproductions of purines can also result from a high purine diet or from conditions that increase cell turnover or breakdown, such as cancers, chemotherapy, or rhabdomyolysis. Elevated serum urate levels and elevated 24-hour urinary uric acid levels would be suggestive of overproduction as the cause of gout. And this is not the case with this patient. He had elevated plasma urate, but he had decreased urinary acid levels over 24 hours. The decreased salvage of purines will also lead to high uric acid. This process of recycling purines plays an important role because it will reuse the free base and recombine it with the active sugar PRPP to reform a nucleotide and not produce the waste product of uric acid. There are two primary enzymes that are responsible for this conversion. The first, adenosine phosphoribosyl transferase, helps to recycle adenine to form adenosine monophosphate, or AMP. Deficiencies in this enzyme mostly affect the urinary tract and the kidneys. Adenine is instead converted to a molecule called 2,8-dihydroxine adenine that forms a crystal in the urine, leading to kidney stones. Stones in the urinary tract of the kidneys then lead to kidney damage or failure, if not treated appropriately. With kidney damage, the body is not able to filter out waste products as effectively. Serum uric acids would not be elevated in this case. The second enzyme, hypoxanthine guanine phosphoribosyl transferase, is responsible for converting hypoxanthine to IMP and guanine to GMP in the process of purine salvage. Deficiencies in this enzyme are characteristic of Lesch-Nyhan syndrome, which presents with symptoms of gout from uric acid buildup, as well as causing neurological and behavioral symptoms. Patients with HPRT deficiency will not be able to recycle and salvage purines, but instead, the bases will further be broken down into their waste product of uric acid. The uric acid will build up and lead to gout. A Approximately 2/3 of uric acid is excreted from the body by the kidneys, whereas the additional 1/3 is through the intestines. Decreased excretion of uric acid is the cause of the majority of cases of hyperuricemia. Increased consumption of alcohol, especially beer, can cause increased lactic acid. Lactic acid will compete with uric acid and will lead to decreased uric acid excretion. Kidney injury or failure can be another cause of decreased urinary excretion of uric acid. Certain medications can also result in decreased excretion, such as diuretics. Along with renal insufficiency, conditions such as hypertension and diabetes can also cause decreased excretion. High serum urate levels with decreased 24-hour urinary uric acid levels, such as in the case of this patient, are suggestive of decreased urinary excretion of uric acid being the cause of hyperuricemia. With the current information given, it is most likely that this patient, in case study number 3, is experiencing gout due to decreased urinary excretion of the uric acid. Additional diagnostic information that may help determine the root cause are listed on this slide here. Initially, analyzing the synovial fluid from the affected joint, his great right toe, should show monosodium urate crystals. The presence of these crystals would prove that the patient has gout. The sample would be negative other bacteria that could indicate infection, and the patient, as he mentioned, did not experience trauma at this site. It would also be very important to get a thorough health history, including history of hypertension, renal insufficiency, chronic kidney disease, diabetes, obesity, or alcohol use. It would also be helpful to know what medications the patient is currently taking, such as diuretics that could increase the risk of uric acid buildup. Additional labs that would be helpful in determining the patient's overall state of health that could be causing gout would be a CMP, CBC, hemoglobin A1C to check for diabetes. This patient states that he recently switched from drinking diet soda to regular soda because he felt that the fake sugar in the diet soda was bad for him. He drinks between 4 to 5 liters of soda a day. He is consuming a very high amount of fructose through this soda. Fructose increases uric acid production and causes the immediate increase in serum uric acid levels after oral consumption. It causes increased uric production from increasing ATP degradation. Fructose breakdown uses up high amounts of ATP and degrades it to AMP. This increases the rate of purine degradation, and AMP would be further broken down through multiple steps to form the waste product of uric acid. Fructose consumption has also been shown to suppress renal excretion of uric acid over long-term consumption. De novo purine synthesis is increased from taking in fructose. More purines will be made, leading to more purines being broken down and more uric acid being formed. Treatment and prevention of gout flares would initially start with lifestyle modifications. Especially in the case of this patient who's drinking 4 to 5 liters of soda a day, it would be suggested to decrease intake of soda or other high fructose items. Also, in going with his full health history, it'd be important to have asked him about his alcohol consumption. Especially beer, taking in alcohol can decrease the uric acid excretion, which is what we are considering to be his cause of gout. Eating less foods with purines, such as certain meats and seafoods, could also help. Weight loss, increased physical activity, along with decreasing high blood pressure, hyperlipidemia, or high blood sugars, if the patient is experiencing these, could also help minimize gout flares in the future. All medications have side effects, so it would be best to try these lifestyle modifications before resorting right to drugs for treatment. However, most patients will end up needing a combination of lifestyle modifications and medications. NSAIDs, cholecalciferins, and corticosteroids can decrease inflammation caused by gout and help reduce pain. Allopurinol or Fexostat can help decrease the body's production of uric acid. In the case of this patient, probenecid could help increase uric acid secretion by the kidneys and help decrease gout flares in his future.